Okay, good afternoon guys. So today I want us to look at another procedure, a procedure which is known as injection giving. So for injection giving, we just want to see if you as a student you are able to give this injection to the patient or the client. Yes. So injection giving is just a procedure which is done to give an injection to the patient intramuscular or IM. Yes. So I have a trolley which is already set. So we have the bottom shelf there with methylated spirit, a receiver with the two needles and a syringe. And we have this receiver here where we are going to discard the used swabs. We have a sharps box where you discard the sharps. We have the top shelf with a drug, a towel, a galley pot with gauze and cotton, a galley pot where you are going to pour methylated spirit, and a receiver where you have to introduce what is on the bottom shelf there. We have hand sanitizer, a pen and a piece of paper for calculations. We also have the patient this side. Yes. So with me is a drug chart with all the details of the patient and the drug itself. Yes. So injection giving is a semi-sterile procedure. You don't have to go to contaminate. It's a semi-sterile procedure. So you still need to maintain sterility. Yes. You use what is known as aseptic non-touch technique. You don't have to contaminate, and we don't have to don gloves. For this procedure, you don't need gloves. Yes. So let's begin the procedure. First thing first, wash hands and dry them. So you do this, clean and wash. Then you get the drug chart. You go to the client or the patient. So you are going to say good morning sir or good morning madam. Yes. So you do this. Good morning sir, I'm student number 10 from Kushi College. I've been assigned to give you an injection. What is your name, sir? So he's going to tell you the name. So he has said is Michael Katongo. So you are confirming. So this is the first confirmation. That's the more reason why you have to go with the sir or madam. You don't have to call his name, but you say sir or madam. First confirmation. So he has said is Michael Katongo. Yes. So you also ensure privacy. You say, don't worry about privacy, I have already cleaned. So at this point, you can even don clean gloves. If you are dealing with the actual patient, you have to don clean gloves so that you can even assess. Remember, you need to demarcate. So you do this. So Mr. Katongo, don't worry about privacy, I have already cleaned. So you turn the patient like this. You don't have to overexpose the patient. Okay. So at this point, you can even do the demarcations. Can you come? So how are we going to demarcate? So you are going to do this. You are going to say, my examiner, I will demarcate starting from the middle sacrum. So from here to the greater trochanter. So you draw a line like that, a straight line. So from the middle sacrum to the greater trochanter, you draw a line, a straight line. Then from the iliac crest to the fold of the buttock, you draw another straight line, and I'm going to inject on the upper outer quadrant. So the upper outer quadrant will be this part here. So from the middle sacrum to the greater trochanter, a line. Then from the iliac crest to the fold of the buttock, you draw another line. Then we are going to inject on the upper outer quadrant, which is this part. So you can do the demarcation at this point. Then you leave the patient like this. Do not cover the patient. Because remember, if you scrub, you're not going to start touching the patient with your bare hands. That means you contaminate. Okay. Then you get the drug chart, you go to the examiner. Then to the examiner, you are simply going to start reading what is on the drug chart. So you're going to say, my examiner, this is Michael Katongo, meaning you have confirmed the rights. Remember the 5 rights, eh? So you say, this is Mr. Katongo, Michael, meaning you have confirmed the right patient. Yes. Then you say, with a diagnosis of syphilis, OPD number 04012, admitted on bed number 2, is also admitted in male ward. Yes. Then date 08/09/2025, drug benzathine penicillin, so right drug. Yes. Route IM, right route there. Then doctor's signature signed by Dr. Molenga. Time at 12 hours. That is the right time. So we are remaining with 1 right. So benzathine penicillin 2.4 mega units. Right dose. So that's our 5 rights. So this is what you are simply talking about. You are just reading to the examiner, confirming that. Okay. Then from there, this you go with it on the table. At this point, you need to do the calculations. So we are saying, let's just do it from here. So this is the formula that you are going to use. You say dose is equal to drug ordered over drug available. So the drug ordered is 2.4 mega units of benzathine penicillin. Yes, so you write 2.4 like this, 2.4 mega units over drug available. So for the drug available, you are going to pick it from the drug on the sterile field. We said do not touch anything here, but you just bend and pick it from there. So you're going to inspect, you look. So it's written that 2.4 mega units. That will be our drug available. Yes, 2.4 mega units. Then times volume. The volume, you're also going to pick it from the drug itself. Do not touch. Once you touch, that means you have contaminated. So just bend. So it's written to say 10 mils of water for injection. So we're going to say times 10. So this is where the 10 is coming from. Then you say is equal to, so this 2.4 and this 2.4 will go, and we're going to have 1 times then the 10 which is here is coming. You just bring down the 10, then you say 1 times 10, then is equal to 10 mils. So 1 times 10 is 10. So this is the 10 mils that we are having there. So this is what you write on the paper. Okay, you have to calculate. After you do the mathematics, this will go to the examiner. You give it to the examiner. Yes. The next thing you do after calculating, you can even go back to the patient or the client to confirm for the second time. So you're going to say, sir, what did you say your name is? He has said Michael Katongo. Oh, Mr. Michael Katongo. Okay. Then you can go back to the table and do the washing. So you wash your hands like this. Then you introduce what is supposed to be used. So we're going to use methylated spirit. So you say, my examiner, this is methylated spirit, and the expiry date is in 2027. So pouring, you go behind the trolley and you pour like that. Then the other things that you have to introduce, you get a syringe. So you say, my examiner, this is a syringe. The expiry date is in 2028. Then you go behind the trolley, you just peel, then you drop it there. Yes. The other things that you're going to introduce is the needles. So you're going to introduce 2 needles. So you say, my examiner, this is a needle. or these are the needles, the expiry date is in 2029. Then you also peel. So we are saying you introduce 2 needles. The other needle will be used for withdrawing the drug. The other one will be used for injecting there. So meaning you have to change. So you do that. Yes. At this point, I can now do sterile hand wash or invasive hand wash. So use sanitizer, do that all the way up to the elbow, all the way up to the elbow. Then I get a towel, dry, like that, behind this corner, the third corner dries up to there, the last corner will go behind, like that. Then this will go there. Yes. At this point, I don't have to drop my hands like this, but I maintain them here. Then the next thing I'll do, I'll get cotton. I soak it here, put it there. Then get a needle, you connect it. Come, can you come close? You connect it like this. Then this will be removed. Then you get gauze. Then don't hold the drug directly from the sterile field, but you use gauze. Yes. So you just hold it like this, then you do this. Or you can just simply do this. The way it was. Sorry for that. Let me just pick it. You do this. Then you lift it. Then you hold it using gauze there. Don't hold the drug direct from the sterile field. Then you withdraw. So we are going to withdraw 10 mils. Yes. 10 mils. Like that. Then this, you can leave it there. Then we have to change the needle. Connect it like this. Then you get cotton. Then you go to the patient. But before you inject, you have to confirm the name of the patient for the last time. So you are going to say, "Sir, what did you say your name is?" "Oh, Mr. Katongo." Okay. Then this, you can put it back there. Then you are going to swab. So just once you do this. Just once. Then this will go in that receiver there. And then you inject. So you're going to inject like this. We are saying intramuscular. So you go 90 degrees. So straight like that. Then try to withdraw. Then you start pushing. If there's no blood there, you start pushing. You're pushing everything like that. Then you do that. So this will go straight in the sharps box. Okay. Then you just compress there. After you do that, you now need to give IEC. So you say, "Mr. Michael, I'm done giving you an injection. I was giving you this injection to promote healing. Make sure you eat for your quick recovery, and make sure you come for the next dose, so that you finish all the medication that has been prescribed for you." Then you leave the patient comfortable like this. You say, "I will document and report to the ward in charge." So you get sanitizer, then you wash your hands like that. Thank you guys for following, and make sure you subscribe so that you continue receiving videos. The next video that I'll do, once you subscribe, you are going to see the notification to say there's another video that has been posted by me. Thank you guys. Cheers.